Namaskar. We would like to welcome you all on behalf of Independent Research Ethics Society, AYUSH SAMRIDDHI International Webinar Conference. Today, our milestone is 2349. We are reaching again on half century past 2300 in 5 years. And as we all are aware, we have conducted 890 plus webinar in these 365 days. This is the only institute where no interruption is there, no Sunday, no holiday, no any type of interruption. So we are conducting daily 3 webinars maximum. I would like to welcome Professor Kamini Dhiman, inspiration of which whom have guided us to start this series, and this series is really well coordinated. So I would like to communicate my gratitude to Professor Kamini Dhiman. I would like to welcome Dr. Givi Thomas. Welcome, madam, from Thiruvananthapuram. Welcome on first time on platform, I hope. I would like to welcome Dr. G. Ramadevi ji. She has also joined with us. Shivani ji, Nitika ji, Sushila ji, everybody. And person will join, all YouTube viewers also. So again, I welcome our speaker of today, Dr. Givit, and again communicate my regards to Professor Kamini Dhiman. And I would like to request Kamini Dhimanji to take charge of the coordination as well as initial words. Dr. Kamini Dhiman, please.
Good evening, Dr. Pavan sir, and good evening to all the participants joined over here and who are viewing the session on YouTube. Although lot many people are saying that send us YouTube link, so they will be attending through YouTube also. And I would like to welcome Dr. Gibi Thomas. She is BMS and MD from Government Ayurved College, Thiruvananthapuram, Kerala. And she is working over there as associate professor, and she is having a gold medal during her studies and written books also. She is co-author of the book Clinical Trials in Stree at a Glance. It's really nice thing. And she is having experience more than 20 years. So we are very glad, we can say that privileged to have her on this platform. And during this series of infertility webinars on every Thursday we are doing, today she will discuss about the management of Stree Vandhyatva. So I would like to welcome her. She will present her topic, and then we will have question answer session. And according to that, we will have discussion on the topic. Over to you, Dr. Gibi Thomas.
Thank you, madam. Thank you, madam. Am I audible, madam?
Yeah, very nicely.
Yeah, okay, ma'am. So, good evening, one and all. Myself, Dr. G.B. Thomas, Associate Professor from Thiruvananthapuram. And it's my pleasure to be here in this webinar, AYUSH SAMRIDDHI International Webinar Series, focusing infertility in practice. And first of all, let me thank Dr. Kamini Dhiman, Professor and HOD, Department of Prasudi Sri Yoga, for inviting me, All India Institute of Ayurveda, New Delhi, the coordinator and the moderator of the session, for inviting me and giving me an opportunity to present this topic. And I'm highly thankful to the convener and host, Dr. Pavan Kumar Sharma, and the distinguished organizers for conducting this webinar to share my insights and views on infertility. And while dealing with infertility, we all know that the incidence is going high in the present scenario. And as a faculty from Ayurveda, I think it's my responsibility and duty to incorporate the effective treatment modalities which have been mentioned in Ayurveda for the management of the same. So for today's session, I have included the basic factors, both the modern and the Ayurveda, so that the basic nidana, the samprapti, the treatment principle, and the effective treatment options, so that each clinician can handle the case with much confidence. And to make it evidence-based, I have included certain case reports also. So let me move on to the topic, sir. So shall I start, ma'am, with the slides?
Yes.
Yes. So coming, the topic given to me is the management of Stree vandhyata. Then the definition, we all are aware that anyway, I'm going through the basic things though, so that we can just have a quick refresh on the things which we have already studied. Then infertility is defined as the inability to conceive within 1 or more years of regular unprotected intercourse, and it can be divided into primary and secondary. Primary means the patients who have never conceived, and secondary denotes a previous pregnancy but the failure to conceive subsequently. Then these all are the basic factors, causative factors. Under that it comes pelvic, uterine, cervical, tubal, and ovarian factors are very common in our clinical practice also. Then coming to Ayurveda, that is Vandhyata, Vandhya Garbha Mubahandi, Vandhya Vakhe Garbhovakadini, then Vandhya Nirapatya Stree, that is a lady without progeny is Vandhya, and the condition is termed as Vandhyata. Then Ihane Archati Garbha Stree, Vadena Upahatada, Yoni Doshena Chanyena. That means Vandhyata can be as a Vandhyata can result due to Bija Dushti, Yoni Dosha, or Vada Dushti. Then again in Charaka Samhita, the Nidanas are clearly explained, that is Yoni Pradoshat, Manaso Abhitabat, Shuklasrik Ahara Vihara Doshat, Akala Yoga, Bala Samshadva, Gabham Chirad Vindadi Saprajabi. That is the Yoni Dosha, Manasiga Dosha, Shukra, Asrik, Ahara Dosha, Vihara Dosha, and Balakshaya are the basic factors which delays conception. Then again, Saumanasim Garbhadharana, that is the physiological, psychological status of the female and the male is also very important in bringing conception. Then again, if the yoni is vitiated, then the shukra cannot be received by a deceived yoni. Again, Vada Pitta Prajotpadane na samartha bhavanti. That is, if the bija or the artava is vitiated by Vadadi doshas, it can lead to infertility. Then again, Idi yoni gadanari, yai shukram na pradichyati, tado garbham na grahnadi. That means this deceased yoni cannot, in a deceased yoni, conception is difficult to occur. So only after proper modalities managing all these yoni rogas, or these basic factors, then only conception can occur. Then again it is seen that in Charaka Samhita, yasya hanga avevasya bije, bija bhage, or bija bhaga aveve, vikardirabadedi. That means the bija bhaga, or the bija bhaga aveva gets vitiated, then it can result in Vandhyata or in Puti Praja. Then in Kashyapa Samhita, it's seen that if excess or Adhishodhana or excess Vamana or Virejana is administered in a Mridu Koshta individual, it can result in it can badly affect Pushpa or ultimately infertility. Then considering all these things, the Bija Dosha, the intake of uncongenial diets, the suppression of the urges, Yoni Dosha, all these can ultimately lead to infertility. Then Artava Vahe, Tatra Vidhaya. So any trauma to the Artava Vaha Srodhas can result in Vandhyatam, Maithuna Sakishnatam, Artavanashishta. Then all these yoni vyavad, all these yoni rogas, if left untreated, can result in infertility. So these basic factors or the causative factors should be taken into account while treating these this infertility. So Vimshadir vyavade yonir, jayinde dushta bhojana, vishamasta angashayana, krisha maiduna sevana, dushta artava.
Please unmute, madam. You are muted. Please unmute. एक मिनट किरण जी. Please unmute.
Okay, now is it audible, sir?
Yes.
Yes. Okay. So under this, so all these the causative factor which are seen as yoni vyabhat nidana can be a causative factor for infertility too. So dushta bhojana, vishamastanga shayana, vrishamaithana sevana, all these are considered as the basic causative factors. Then coming to the types of Vandhya, 6 types are seen. That is, it is mentioned in Haritha Samhita. That is the Balakshaya, Kagavandhya, Anabhatyada, Garbhasravi, Mrtavalsa, Dhadukshaya. So Kagavandhya, one-child infertility. Anabhatyada, it's a state of primary infertility. Then Garbhasravi can be correlated with recurrent miscarriage. Then Mrtavalsa or stillbirth. Then infertility due to Dhadukshaya can be correlated with this Dhadukshaya Vandhya. Then in Charaka, Vandhya, Sapraja, Apraja. These classifications are seen. Vandhya means Yasya Shonide Garbhashya Bija Bhaga Pradoshamavadide. That means the Bija Bhaga, if gets vitiated, it can result in Vandhita. Then Apraja, Yasya Lebde Garbhe Abhi. So even though conception occurs, it gets aborted due to some disruption in the hormonal factors. Then Sapraja, even though the female possesses, she can be infertile later also. Then this Pushpakni, it's a condition mentioned in Kashyapa Samhita. That is, it's mentioned that Vritha Pushpam tu Yanari. So the cycles are there. Vritha Pushpa means it may indicate an anovular cycles. And Stula Lomasha Ganda, Pushpakni. So Staulyam, Lomasha Ganda, all these can be a feature of polycystic ovarian syndrome also. Then the next terminology we can find in classical textbooks is Putrakni. That is Stidam Handigarbham, Putrakni Rektastamsra. Here Stidam Handigarbham. Here habitual occurs, abortion occurs, even though conception occurs. Then coming to Sadhya Sadhyada, Balavandhya is considered as Sadhya. All the other Vandhyas, even Dhadukshaya Vandhya can be cured with some treatment options. Then coming to the treatment, that is Chikilsayam Pradhanam Avasthanu Vidhanam. Then Samkshepada Kriya Yogo Nidana Parivarjana. So it can be the treatment according to the condition can be offered. Then Nidana Parivarjana. All these Nidanas should be eliminated and excluded. Then again, for the treatment of Vandhyata, Vadaja Yoni Roga Chikilsa, Pittaja Yoni Roga Chikilsa, and Kapaja Yoni Roga Chikilsa can be incorporated. And Vadaja, under Vadaja, it comes Shaside Karma Vadajit, Snehana Sweda Vastyadi, Vadajasu Visheshadaha. Then, under Pittaja Yoni Vyavat, it's mentioned that Pittalanam to Yoninam, Sega, Abhinga, Pijukriya, then Sida Pitta Hirakarya. Here also all Pittahara measures can be employed, and along with that, Snehana, Krida, Snehana with Kridas can also be given. Then in Kapaja Yoni Yoga management, all the Rukshoshna Prayogas are seen beneficial. Hence, all these treatment options can be incorporated for the management of Vandhyata. Then in Kashyapa, it's clearly mentioned that Snehana, Sweda, Vabana, Vijayana, Asthabana, Anuvasane, Kramasha Ubajare, Madhur Aushadha Siddhapyam, Kridakshira Pushtam Purisham, Striyam tu Tailamashabhyamit. So, Vamana, Virejana, all these Shodhana procedures can be done, and the man should be treated with Madhur Aushadas, Krida and Kshira. The female should be treated with Tila and Masha. Then, the importance of Anuvasana Vasti is clearly mentioned. That is Alpa Pushpa, Nashta Bija. In all this, Alpa Pushpa means it may indicate an oligo-ovulation. Then Nashta Bija, an ovulation may be indicating here. In all these conditions, Anuvasana is best indicated. Then again, the Sthanika Chikilsa, that is Sarvada Subhishuddhaya, Sheshankarma Vidhiyade, Vasti, Abhyanga, Parishega, Praleba, Pijudharana. After all purification measures or by eliminating all doshas from the body, this Sthanika Chikilsa can be employed for the management of Yoni Roga Chikilsa as well as for the management of infertility. Or the Vandhyata Chikilsa can be summarized like this. That it can, the Garbhadhana Purva Karma, Prathana Karma means Shodhana Chikilsa, Shamana Chikilsa, and Deva Vipasra Chikilsas are there. And under Shodhana comes Sarvadeha Shodhana and Sthani Chikilsa. Under Sarvadeha Shodhana, it comes Panchakarmas are given prime importance as it can eliminate these doshas completely from the body. Then under Sthaniya Chikilsa, it comes Yoni Prakshalanam, Yoni Piju, Uttaravasti, etc. Then coming to the importance of Panchakarma in Vandhyata, and in Kerala, these Panchakarmas are highly in practice, and it can eliminate the doshas from the body, and it can ensure dhatu satmya, and it can be a measure for the prevention of dhatu vaishamya. And it has given a special status in Ayurveda, especially in the management of Prasudi and Stree. Then very beautifully it is narrated in Ashtanga Hridaya that the benefit of Panchakarma, that is Neha Klina Koshtaka Thadugava Sroto Lina Echa Chaka Asti Samstha Dosha Svedeste Drevigritya Kostam Nito Samik Chuddhivat Nirhyade. That is the vitiated doshas which are situated in the koshta gets liquefied, that softened by snehana, liquefied by the svedana, and through appropriate shodhana procedure it can be eliminated from the body. And these panchakarmas include Vamana, Virejana, Nasya, Niruha, and Anvasana Vasti. Then Amashegada doshas get eliminated by this Vamana, Pakvashegada doshas by Virejana, and Urtha Jatrugada doshas get eliminated by Nasya. Then Vasti is indicated for Vada, Virejana for Pitta, and Vamana for Kapha. Then this Uttaravasti possesses both the qualities of Snehana and Anvasanavasti, but usually it is done with Sneha, it's included under Anvasanavasti. Then the beautifully narrated, that is the benefits of Shuddha Koshta. Evam Vishuddhadi, Koshta, Kaya, Agni, Abhivartade. So once the Agni can be corrected, the basic factor can be corrected. Then Balam Pushti Rabatyamda, Vishadasya Jayade. That is Balam, Pushti, healthy progeny. All this can be achieved after this eliminating these doshas through Panchakarma measures. Then again, dosha kadajit kupyadi jida lenghana pajane, jida samshodhe teshu na tesham punarudbhava. That is, once they are actually or perfectly removed from the body, it is difficult for the recurrence. Then again, this sarvada suvishuddhaya, shesham karma vidhiyate, vasti abhyanga, all these sthanika chikitsa can be employed after proper purification methods. Then the benefits of a Shuddha Koshta, that is Evam Yonishu Shuddhasu. So once the Yoni is free from these disorders, then Garbham Vindati Yoshida. Then Sarva Vyabana Yonim to Karmapur Vamanadupir, Murdupir Panjapurnari. So in ladies, while administering these Panchakarma procedure, it should be done in a Mrudu manner. Then coming to the superiority of Vasti among Panchakarma, that is Vasti is best indicated in Vada, Pitta, Kapha, Rekta, all these Vikaras. Then in all Bija Dosha, Yoni Vyabhat, Vanthida, Garbhasravi, all these things, this Vasti can be done. Then this Garbhadana Purva Karma, it comes Snehana, Svedana, Vamana, Virejana, Asthabana, and after Shodhana, man can be given with milk processed with Madhura group of drugs, and the woman can be treated with Tila and Masha. Then this Snehana, Svedana, or everything can be incorporated into Garbhadana Purva Karma. Then Pumsa Karma are also considered as a treatment, as a methodology which can be incorporated for the management of infertility. And the Pumsavanam is the Pumstakarakam Karma. So it can have numerous benefits like Garbha Grahanartham, that is for achieving conception, then Garbha Sthabanartham, achieving stability. This property can be made use of while treating the habitual abortion, Pumsavanartham, or for the said sex. Then Panchakarmas are seen highly beneficial for the management of Stree Rogas. Under that, it comes Purva Karma, Pradhana Karma, and Paschat Karma. Then Vamana, for the Vamana is indicated for PCOS, obesity, insulin resistance, etc. Then Virejana for Rektaja, Mamsaja, Yonido doshas, and Artava dosha, Menarajya, Metrajya, etc. It can be employed. Then Vasti is indicated in all gynecological disorders. Then Nasya is also useful in Artava in also hypogonadotrophic conditions, and it can stimulate the gonadotrophin releasing hormones. Then, or summarizing the management of Vanthida, it includes Garbhadana Chikilsa, Pumsavana Karma, Yoni Vyabhat Chikilsa, then Shukla Artava Doshahara Chikilsa, along with Vanthida Chikilsa. Then, Vamana is best indicated in ovarian factors or in obesity, Virejana for Yoni, old Yoni Vyabhat, then Nasya for CNS factors, hypogonadotropism, hyperprolactinemia, then Asthavana Vasti, then Anvasanavasti is indicated in hypogonadotrophism or Anvasanavasti in all the infertility. Then Uttaravasti is also indicated in all yoni rogas, ovarian dysfunction, etc. Then here I have selected certain yoni rogas for disease conditions which can lead to vandhyata if it is left untreated. And one by one we will take. The first one is the Artavakshaya. Then the second case Nashtartava. Then Vadiki. Then Paripluda. Then Putrakni. Again Thadukshaya Vandhya. Then coming to this Artava Vyabhat. That is Nashtartava. Doshiravrta margatvad artavam nashyati. So, avarana may result from excessive obesity or in thyroid dysfunction, and it can be seen in PCOS and thyroid disorders or in obesity. Then Shinartava, Shina Marida Pitta, that is Vada and Pitta are the causative factors for Shinartava. Then Lokhitakshaya Urta, Vada Pittapyam Shiyaderajaha. Then Artavakshaya Yadojida Kala Adarshan. So regular periods is now it's missing in Artavakshaya conditions. So coming to the Samprapti, all the above said Nidanas can vitiate the doshas, especially the Abhanavada, and it can cause the impairment of Pittala nature, and it can result in Artava Vyabhat, Shinartava, etc. Then coming to the modern perspective, that is significant weight gain, thyroid problems, PCOS, increased stress and improper sleep, all these can disrupt the delicate HPO axis or the Pittala nature, which can result in infertility. Then coming to the second amenorrhea, that is the PCOS and premature ovarian failure are considered as the main causative factors. Then the modern perspective, that is the polycystic ovarian syndrome. We all know it is described by amenorrhea, hirsutism, and obesity, and it is responsible for 30% of secondary amenorrhea and 80% of oligomenorrhea, or which can, if left untreated, it can result in vandhyata. Then we know the clinical features: increasing obesity, menstrual abnormality, then there's menstrual disorders like oligomenorrhea, hypermenorrhea, secondary amenorrhea, dysfunctional uterine bleeding, all these things can be seen. Then in unmarried, all these clinical features are seen: obesity, weight gain, menstrual disorders, facial hair, pigmentation. And in married women, along with this, inability to conceive is also a presenting feature. Then these all are the signs. Then coming to the pathogenicity, that is, there is usually these PCOS patients tends to weight gain or obesity. Whenever there is obesity, this insulin resistance or the body will be showing some insulin resistance. So in order to overcome this situation, body will be producing more and more amount of insulin. So a state called hyperinsulinemia exists, and the SHBG production will be low. So there will be freely circulating testosterone, and this causes and estrogen. This will be aromatized to estrogen, and in breast it causes breast hyperplasia, and in the uterus it can cause uterine hyperplasia. Then along with this, there is an abnormal GnRH is seen in the pathogenesis of PCOS, and this GnRH is preferential to luteinizing hormone LH. So this increase in LH will cause theca cell hypertrophy, and there also excessive androgen production seen. Then this, due to the action of inhibin on the FSH, there will be the lowered FSH is seen. It can result in defective growth and development of the ovarian follicle, or which results in anovulation and infertility. Then obesity can result in hypertension, the diabetes mellitus, and cardiovascular problems later in life. Then coming to the Ayurvedic perspective, no direct mentioning of the disease is seen elsewhere, but Vandhya, certain terminologies are seen: Vandhya, Nashtartavam Vidya. Then Dosha Avarda Margatva, Artavam Nashyadi. This avarana may be due to excess weight gain or the Vada, Kapha, Mamsa, Medo, Dushti. Then Kshina Marida Pittada, that is Kshina Artava or oligomenorrhea is a feature in PCOS. Then Artavakshaya, Edojida Kala Darsana, that is periods doesn't occur at regular intervals. Then Pushpakni, Jadaharini. The features mentioned for PCOS can be seen in this condition also. Vridha Pushpam, an ovular cycle, Stula Lomasha Ganda, all these things can be seen in PCOS also. So coming to the complex pathogenicity, then we will be, while if we can go through the complex pathogenicity, then we will be able to tackle the overcoming the complex pathogenicity. We can administer proper medications and proper Panchakarma bias. So these Nidanas causes Agnivaishamya. It can cause Samarasa, Visheshana Pada, Pitta and Kapadosha, or it can ultimately lead to the Uttara Dhadu Dushti, Medo Dushti, Apanavada Vaigunyam, Artha Srodo Dushti, and it gets Sthana Samsaya in the yoni, and in Andhashya it causes defective follicular genesis or anovulation, and in Garbhashya it causes menstrual irregularity, Nashtartava, Kshinartava, etc. And this disordered Vada, Kapha and Mamsa can produce Sandarpanotara Vyadhis like Prameka and Staulya. There will be Dhattvagni Mandyam, and this Adilomada or increased Dhadu Mala can also be seen as hirsutism. And all these things all end in anapatyada or infertility. So the main symptoms in PCOS can be grouped under Artava Dushti, Staulyam, Adilomada, Anapatyada, Karshnyam, Artava Kshaya, and Khaladi. Then the management is very important. It's seen that for delayed and irregular periods, tatra samshodhanam agneyanam chidravyanam iti padabe. So all shodhana procedures, vadanilomana, agni-dibana, kapha medohara medication and procedures are seen beneficial. Agneyanam chidravyana, that means the pittala, the group of drugs having pittala nature, or that will promote the which increases the pittala nature, or which can induce the menstrual cycles can be employed here. Then lifestyle can be modified. Then weight reduction in Williams gynecology, it is clearly mentioned that 5% of the weight reduction can resume the cycles and ovulation. And for that, the treatment options are, the best treatment options mentioned are Udvartanam. Triphala Churnam can be, Kolakulathadi can be taken. Then it is Udvartanam, Kapaharam, Medasa Pravilayanam. That is, it's good for reducing weight. Ruksha Svedam, Churnapinda Svedam, then Snehabanam, Varanadi, Sugumara Kridam, Shatpala Kridam, then Vamana using Madana Kalka, then Niruha Vasti, in order to eliminate these doshas and dushas from the body, this Madhu Tailiga Vasti is beneficial. Then Anivasana Vasti with Dhanvandaram Tailam and Pippaliyadi. It's to bring down this ovulation and to restore the functions of the impaired this hypothalamo pituitary ovarian axis. It is good. Then Nasya, in order to rejuvenate the hypothalamo axis, Nasya with Jivaniya Ganakrida, Shadabushpa Nasya Taila can be taken. And for infertile patients, Rajayavana Vasti, Uttaravasti, and Pumsana will be the good options. Then Lesinas can play vital role for the maintenance of or the pacification of these and to prevent its recurrence. So under that comes Leshuna and Shadabushpa Rasayana. Then in PCOD presenting with DUB is difficult to manage because all these Agneya Upacharas can be employed only after bleeding stops. So during bleeding phase, Pitta Shamana treatment can be adopted. But after when the bleeding stops, all Agneya or basic Vadanilomana, Pittalophacharas can be given. Then coming to Vadagi Yoni Vyavat, the quotation, we all know the quotation. And this can be compared with the endometriosis, or it's the presence of the functioning endometrium outside the uterus. And the prevalence in infertile women is 20 to 60%, and 40 to 50% with pelvic pain suffer from endometriosis. Then these always abstain from these risk factors: never giving birth, delaying conception, genetic factors, immunological problems, higher intake of red meat, late menopause, etc. Then here there is the pathology includes cyclic shedding of the endometrium, and this periodically shed blood may get encysted, and it may enlarge with cyclic bleeding. And normally this cyst is seen as chocolate colored cyst in the ovary. Then mainly there is an immune dysfunction or the defective cellular immunity responsible for the ectopic tissue is seen in endometrium. So there will be peritoneal inflammation, and this activated macrophages, cytokinins, etc. can again promote the growth of the endometrium, and this dense tissue reactions surrounding this produce puckering of the peritoneum. And in all these conditions, these Ayurvedic treatment upayas like the Shodhana procedures then Anuvasanavasti, all these things are C beneficial. Then the symptoms are dysmenorrhea 50%, then dyspareunia, then menstrual abnormality like menorrhagia, metrorrhagia, etc. Then 40 to 60% of endometriosis cases are infertile, and 20 to 40% of female infertility shows endometriosis, and the hormone, it may be due to the luteinized disrupted hormonal pattern, anovulation, luteinized unruptured follicle, and elevated prolactin levels. Then complication, infertility, then the pelvic adhesions due to this intense tissue reactions can cause pelvic adhesions. So there will be impaired ovum pickup by the fimbriated ends, and this ejaculates can in some cases it may rupture and it can produce acute abdomen. Then coming to Ayurvedic perspective, there is no direct mentioning is seen elsewhere in the textbooks, but the symptoms can be correlated with Vadaki Yoni Vyabhat. Then this in Pariploda, severe pain during intercourse is seen, and the menstrual abnormalities in Vadaki can be included under Strigdara and Rektayoni. So here also we can go deep into the pathogenesis. Here there is Vada due to Ahara and Vihara dosha. Vada, Pitta and Kapha gets vitiated, and this Vada causes ectopic deposition, Pitta causes inflammatory changes, and the Kapha causes the proliferation of these ectopically deposited endometrium. Then finally, all these things result in Arthava Dhadu Dushti or anovulation and infertility. And there is local cellular immunity impairment, and for the management of the disordered immunity, this Ayurveda medications and procedures can play vital role. And to prevent its recurrence, these Shodhana Ubayas can be employed. And in order to prevent these conditions, these treatment adoptions can be best suitable. Then coming to the Samprapti, there is Nidana causes Agnimandya, then Apanavada Vaigunyam or the Vimarga Gamana of the Artava. This Vimarga Gamana causes ectopic deposition, then it causes chocolates formation, pelvic adhesions, and ultimately leading to Anapathida. All these doshas get localized in the yoni and causes painful menstruation, Vadagi Yoni Vyabhat, and Anapathida. So Chikitsa, because the Vada is the main causative factor for the ectopic deposition of the endometrium. So all Vada Shamana Upayas like Yoni Vyabhalsu Huishtam, Shasade Karma Vadajit, Snehana, Sweda, Vastyadi, all Vada pacification methods can be employed. Then Nidana Parivarjana plays vital role. Vegatharanam, Mityahara Viharam. Then Rajasala Charya should be employed. Proper rest should be taken during periods in order to prevent the retrograde menstruation. Then Vadanilomana Chikilsa in order to prevent the ectopic deposition. Vanavayu Anilomana Chikilsa. Then Vadagi Uniroga Chikilsa to manage the pain. Then Srodo Shodhana Chikilsa in order to eliminate these doshas and dushas from the body. Then Vandhyata Chikilsa in order to bring conception, and Asayana Prayogas in order to boost the immunity and thereby curtailing the ectopic deposition and growth of the endometrium. Then again, the Sthanika Chikilsas are very highly beneficial in the management of endometriosis, especially in case of pelvic adhesions, and to relieve from pelvic pain, this can be employed. Then for the management, it comes the Snehabanam, that is Indukanta Kridam, Ugulutiktakam, Shatpala Kridam, Sukumara Kridam, all these can get rid of the ectopic deposited endometrium. Then Svedana, Videjana with Gandharvarandam, Hingutraganagam, then Vasti with Niruha, Matadailiga Vasti, then Anuvasana Vasti to bring down this to rejuvenate the hypothalamus axis and to make induce ovulation, Mahanarayana Thailam, Pippaliyadi Thailam, Dhanvantaram Thailam. Then Rajayamana Vasti. Then Rajavasana Vasti is highly beneficial in achieving conception. Then Uttaravasti can be best indicated, is best indicated for the management of this infertility. For that, Dhanvantaram Thailam, Dadimadi, Palasarpis, Mahanarayanam can be taken. Then Kayasegam or the Pirichil can improve the immunity level. For that, Mahanarayana Thailam, Dhanvantaram Thailam can be taken. Then Nasya for the hypothalamus pituitary ovarian correction. here, Shadapushpanasya Thailam, Jivanya Ganakradam are seen highly beneficial and effective. Then it comes the preventive method that women are encouraged not to delay the first conception. Then pregnancy cures the condition. Then resigners to improve immunity can be given. Then Triphala is for daily virajana, it can be given. Then these antioxidants can remove the free radicals and inflammatory changes. Then hot, dry, spicy food can be eliminated from the daily diet. Then enough fiber should be added in food. Then coming to Paripluda Yoni Vyaba, the basic quotation we all know can be compared with the pelvic inflammatory disease, or it's a spectrum of infection and inflammation of the upper genital tract. Then these all are the risk factors, that is multiple sexual partners. Then previous history of acute PID, IUD users. Then Neisseria gonorrhea, chlamydia are seen as the causative factors. Then clinical features, it comes bilateral lower abdominal pain, dyspareunia, irregular excessive vaginal bleeding, pain and discomfort in the right hypochondrium. Then vaginal examination, abnormal purulent vaginal discharge can be seen. Then congested cervix with purulent discharge. Then diagnostic criteria, adnexal tenderness, cervical motion tenderness, and uterine tenderness is seen. Then this chlamydia caused by Chlamydia trachomatis can produce intense mucopurulent discharges and intense adhesions, and infection may go up and it can cause acute PID. Then these complications are tubo-ovarian mass, then tubal damage due to as the motility of the tube will be badly affected, it can cause infertility, and the motility tubal damage can end in sometimes it can end in ectopic pregnancy also. Then complications, dyspareunia, infertility. So after 2 episodes, it increases to 25%. And after 3 episodes, it rises to 50%. Then there is chance for the rate of or the risk of developing ectopic pregnancy also gets increased. Then these nidanas, vegatharnas, agala bhojanas causes avanavada vaigunyam. Then this pitta, adi pittala sevanam, pitta goba, rekta pitta dushti, all these vitiate the acne and causes ama, improper rasatadu formation will be there. It reaches the garbhashya. Then again, these sagandu factors like microorganisms, all these will disturb the normal defense mechanism and get localized in yoni, and it causes or the from the lower genital tract, it invades upper genital tract, and it finally ends in Paripluda Yoni Vyapati. And come to the Chikitsa, that is all Yoni Roga, that is common, Vadiga Yoni Roga Chikitsa, along with Pittaja Chikitsa can be employed, along with Stanika Chikitsa. So, Sega, Apyanga, Pijukriya, then Shida Pitta Jidakarya, all Pitta Shamana Upayas. And this for Snehana procedures, Kridas can be best option. For that, Mahatiktakam Kridam, Shadavariyadi Kridam, Gugulutiktakam Kridam are seen beneficial. Then Apyanga with Pindatailam, etc. can be given. Then Avibhati Churnam can be taken for Virejanam. Then Staniya Chikitsa like Piju, Segam, Avasti, etc. can be given. Then Uttaravasti also is seen beneficial. Then coming to Garbhasravi Vandhya or Putrakni, it is mentioned as Stidam Handi Garbham Trakni Rekta Samsra. So it means repeated abortion occurs even though conception occurs. Raukshad Vayuryada Garbham. So the main factor which is getting disordered is the Vada. Dushta Chonidam Narya. So the Vada, Rekta, Pitta gets vitiated and it ends in recurrent pregnancy loss. So it is the definition is the occurrence of 2 or more consecutive spontaneous losses prior to 20th week of gestation. Then habitual abortion, habitual miscarriage, all these are the symptoms, all these are the synonyms. Then under etiology, it comes some genetic factors can be the anatomic, endocrine, immunological, microbiological, environment factors are also there. Then under endocrine, it comes diabetes, thyroid dysfunction, then PCOS, then immune factors, that autoimmunity, then ANA, APS syndrome, then endocrine factors, thyroid diseases, diabetes mellitus, hyperprolactinemia, polycystic ovarian syndrome, luteal phase defect, all these can ultimately result in recurrent pregnancy loss. Then this progesterone is essential for the implantation. A defect in the corpus luteum also can cause impaired progesterone production and ultimately pregnancy loss. Then infection with the oxoplasma, cytomegalovirus, etc. can result in recurrent pregnancy loss. So under ahara, kattu amla spicy food come, then vikara, akala bhojana, vegataranam, etc. Then bela disordered or impaired immunity. All these can vitiate vada, pitta, and sadushti. Then artavadushti, uttarottara, or the some aganduja factors are also there. All these things causes rektadushti, uttarottara dhadudushti, and artavadushti. All these doshas and dushas get localized in Garbhashya and it causes Garbhasravi Vandhya. Then coming to Chikilsa, that is Samkshepada Kriya Yogo Nidana Parivarjanam. Then Chikilsayam Pradhana Vastanu Nidana. That is according to the condition, this can be treated. Yoni Roga Vadiga, Yoni Roga Chikilsa and Garbhasrava Chikilsa can be incorporated for the management. For that, Snehapanam, Dadimadi, Palasarpis can be taken, Virejanam with Gandharvarandam, then Astavanavasti, Mustadi Anivasanavasti, Mustadi Rajayavanavasti is seen beneficial, then Anivasanavasti with Pipalyadi, then Anivasanavasti, Dhanyandaram, etc. can be employed. Then Uttaravasti with Palasarpir, then Dadimadi Kردam, Mahanarayana Thailam can be taken. Then next is the Dhadukshaya Madhya. Or here there is, it's mentioned by Haridha Acharya. Then here there is Rasadhadu Dushti or Rasadhadukshaya. Then Uttara Dhadukshaya, Chukradhadu, and finally Artava Ubadhadukshaya ultimately result in Dhadukshaya. And it can be combined with diminishing ovarian reserve. Then the etiological factors are follicular atresia, endocrine disrupting chemicals, altered expression of the genes, endometrioma, oxidative stress, chemotherapy, etc. Then the clinical features seen are primary and secondary infertility, then vaginal dryness, dyspareunia, irregular cycles, scanty or excessive bleeding. Then coming to the Nidana, that is all Yoni Pradosham, Manasiga Tabam, Shukrartava Dosham, Ahara Vikara Dosham, Akala Yogam, Bela Samshe, all these can be attributed to Dhadukshaya Vantya. So Akaraja, Katumla Levana Ahara, Vikara Dosha, then Vegatharnam, etc., then Payam, Shogam, then Akala, genuine factors, then Shastravidha, some procedures, then Madrija, Padirja, or the chromosomal anomalies. Everything can be an attributive factor. So this ahara, vihara, manasiga bhava, vadavritti causes vadavritti, pitta dushti, kapakshayam. There is chance for Agni Vaishamya, Rasadhadukshayam. So Uttaratra Dhadukshayam ultimately result in Artava or Shukra, Artava Dhadukshaya, and finally results in Dhadukshaya Madhya. Here also the treatment include Agni Deepanam in order to promote to restore the functions or to enhance the Agni Deepana procedure and to eliminate if the excess doshas are there. So the Shokana Chikilsa should be done. Then Sthanika Chikilsa in order to produce more, to have more action in the Garbhashya. Then Rasayana in order to promote the fertility rate. Then Vamana and Virajana in order to expel excessive vitiated doshas and dushyas. Then Raja Vyavana Vasti in order to promote conception rate. Then Shadapushpa Rasayanam in order to increase the this Balakshaya, or in order to promote ovulation or to bring down restore the functioning of the reproductive system. This Palasurface is highly useful. Then I have included certain case reports in order to make it evidence-based. Then this show the effectiveness of this Ayurvedic treatment modality in curing the condition, and it can induce ovulation or infertility. So how we can manage this infertile cases, that is shown with the help of these case reports. And for this can be employed for correcting the hormonal imbalance and making the endometrium more receptive, or which can have action on Ridu, Kshetra, Ambu, and Bija. So first is a case of, even though these all are primary infertility or infertility cases, and infertility due to various causes have been documented, so that we will be able to know how these treatment modalities are useful for the management of the same cases. So first case is having low AMH and oligoasthenospermia. Then with the oligoasthenospermia, then the lady was suffering from irregular periods since menarche, then inability to conceive even after 3.5 years of married life. Then as she couldn't conceive after 6 months of regular unprotected intercourse, she approached a gynecologist, and in male partner, the semen analysis was done, and it showed oligoasthenoteratospermia, and necrospermia was also there. And he was under allopathic management for 2.5 years, but couldn't conceive. The AMH was low, and the following treatment patterns were given. That is, Udvartanam with Triphala Churnam was given for 7 days. Snehabanam with Jivani Ganam for 7 days was given. Apyangam with Mahanarana Thailam and Ushmasvedam was given for 3 days. Virejanam with Gandharvaranda Thailam. Then Yogavasti with Mutsadi Rajayamana and Snehavasti with Pipalyadi Anvasana Thailam. Then Uttaravasti with Phalasarpis. Then Kayasegam with Mahanarana Thailam for 7 days. Then Pradimarshanasya with Jivani Ganakradam was also given. Then Shadavushparasayanam was given, starting with a dose of 15 gram and with Tela Thailam for 21 days. Then Shamana Aushadam, Saptasara Kashayam 90 ml was given. Then this Vadashungam 8 numbers was given with milk for 10 days. Then Pradimarsha Nasim, what Jivani Ganakrada was given for 20 days. Then follicular study, finally the follicular study was done, and it showed a dominant follicle. Then this is a case of primary infertility due to endometriosis and PCOS. The patient was having 28 years old. Then she was suffering from irregular periods since 15 years, and there was severe pain during menstruation, and there was inability to conceive even after 5.5 years. And she ovulation induction and IUA was done, but all these measures failed. Laparoscopic additional lysis was done. Hysterolaparoscopic additional lysis was done. Along with that, bilateral ovarian rupture drilling was also done. And finally, she was advised with IVF, and she took various treatment options from Kerala and abroad. And from our hospital, treatments were given. Udvartana with Triphala Churnam, Churnapinda Svedam, Acha Snehabanam with Murchida Tilatailam. This Tilathaila was processed with certain group of drugs. Then Acha Snehabanam. Then Apyanga with Thanadaram Thailam, Virejana with Gandharvarandam, Mathu Thailiga Vasti, Yonipuranam with Phalasarpis, then Kayasegam with Mahanarana Thailam, then Pradimarshanasya with Jivaniya Ganakradam. It was given for 7 days. And in the second cycle, Virejana Snehabanam with Murchida Tilathaila, then Mustadi Rajayamana Vasti, Avagahasvedam in Dashmula Kwadam is also done. Then Shamana Aushada given where Hingwajadi, Saptasarangashayam, Tilakwadam, Shogarishtam and Apayarishtam. Then for Rasayana, this Shadabushpa Rasayana was given starting with a dose of 10 gram with Teladaila. The dose was gradually increased for 15 days. And finally, with regular medication, she conceived and delivered. And dysmenorrhea was considerably relieved also. Then third one is a case of primary infertility, PCOS. She was presenting with irregular menstruation and inability to conceive. And this PCOS, several medication for PCOS was done. And she couldn't conceive. She was admitted. Then medicines given were Vaishwanara Churnam, Pandravasadi Kashayam, then Udartana with Kolakulathadi, Churnapinda Svedam, Chabana with Marakradam, Matravasti with Pipalyadi, Nasya with Shidabala, Shadavushpara Saina was also given, and it was positive, and she delivered a female baby. Then this is a case of Garbhasravi, that is PCOS, irregular menstruation, and inability to get a child even after 2 years. See here also, spontaneous abortion occurred at 8 weeks twice, and she consulted a gynecologist and she diagnosed PCOS. And here also, Udvartana with Triphala Churna Pinda Sweda with Triphala, Snehapana with Sukumara Karda, Aphinga and Ushma Matravasti with Pipalyadi and Vasana Thailam, then Yogavasti, Rajayamana Vasti, and Pipalyadi and Vasana Thailam, Uttaravasti with Phalasarpis, then Pradhimarshanasya with Jivani Ganakradam, then Shadavushpa Rasayanam, Anibanam was Telatailam for 4 days, and starting work, it was gradually increased. And finally, UPT was positive, and she also delivered a normal baby. Then Garbhasravi with torch infections were there. In consecutive 2 abortions occurred after first delivery. And then for 4 years after marriage, she was conceived. It showed less cardiac activity. MT was done at 10th week. Again, after 4 months, she got conceived, but spontaneous abortion occurred. And here also, Gandharvasadi Kashayam for pacifying this Vada, then Vaishwaryanara Churnam, then Achasnehabana with Dadimadi, Yogavasti Kashayavasti, Mustadi Rajayamana Vasti, then Snehavasti with Pipalyadi, then Matravasti with Pipalyadi, Kayasega with Anudratailam, Pradhimarshanasya with Jivaniya, Desainam with Shadvushva Churna was given. And thus Peral Mota or Vadashungam, as Pumsavana was also given from the 4th day of periods, and Jivaniya Kanakradam was also given. Then UPT was positive, and she also delivered a healthy female baby. Then this is a case of primary infertility. It's due to husband was suffering from oligospermia, and regular the wife was having, lady was suffering from irregular periods, and inability to get a child after 6 years of marriage. Follicular study done, it revealed no ovulation, and semen analysis was done. The sperm count was only 7 million. And for the female partner, Gandharvasadi Kashayam, Vaishwanara Churnam was given, and Udvartana with Triphala, Achasnehabana with Dadimadi Krada, Apyangam with Shadavariyadi and Ushmasweda, Matravasti with Pipalyadi and Vasanam, and she was given Saptasarang Kashayam, and the cell with Guda was also given. And the male partner was also admitted, and Gandharvasadi, Vaishwanara Churnam was given, Palashatta Kwatham was also given. Here we was also given treated with Achasnehabana with Jivani Ganam, Aphinga with Mahanarana Thailam, Matravasti with Pipalyadi. Then finally, semen analysis was done. It was 25 raised to 25 million. Liquefaction time was almost normal, 30 minutes. And the female partner was again admitted, and Senehabanam, Padmashanasya, Matravasti was again done. And all these medicines were advised. And finally, UPT was positive, and she also delivered a male baby. Then next is the case of Garbhasravi Vandhya. She got married at 25 years. After 7 months, she was diagnosed with right ectopic gestation. After 1 year also, she conceived again, but it also USG showed no definite gestational tag and thick elevated cystic lesion, and it was also diagnosed as this ectopic gestation. And after 1 month of abortion, she came to our OPD. She was admitted, and Uddartana with Kolakulathadi was given. Churna Pindasvedam with Mahanarana Thailam, Virejinam with Avipatti, Snehabana with Sukumarakradam, then Apyangam, Virejinam with Drapala Churnam, Matravasti with Pipalyadi Anivasana Thailam, and a sign with the Chadabushva and Tilathaila was given. UPT was positive, and she delivered a male baby on May. Then this is also a case of Nashtartava, or the 30-year-old female was suffering from irregular menstruation and the inability to get a viable child after 4 years of regular unprotected intercourse. And for the last 3 years, her periods were absent for 6 months, for about 6 months. And afterwards, she got 2 to 3 cycles only in induction with allopathic medication, and admitted in a hospital. And USC showed polycystic ovarian syndrome, and she was admitted, and she was given with Udvartanam with Kolakulathadi Churnam. Then Varanadi Kashayam and Saptasara Kashayam was given morning and evening. Then Tilakvatham. Then Achasnehabana with Sukumara Kardam was also given. Apyangam, Ushmasvedam, then Virejanam, then Rosadi Kashayam was also given for Vadani Lomanam. Then Sadapushpa Churna with milk was also given for Rasayanam. And after the IP treatment, the patient lost weight, about 10 kg of body weight was lost. And soon after the Chodhana Chikitsa, she started menstruation. And that's all the slides. And thank you very much for the patient listen.
Very, very nice. Thank you so much. Your cases are really excellent. You have shared. So the session is open for questions. We will take up the questions. I think many questions regarding Shatapushpa. People are asking about your choice, that is Shatapushpa Rasayanam.
Yeah.
Will you, madam,
Shatapushpa,
elaborate?
yeah,
Yeah.
Shatapushpa. Yeah, Shatapushpa is, I think it's having action in promoting this ovulation and correcting periods and all. Especially in cases of this PCOS or there is Avarana due to Vada, due to Kapha and Medo dosha, this Shatapushpa is highly beneficial in correcting this, restoring the function and correcting menstrual cycles. So once these menstrual cycles are corrected, that means we are inducing ovulation. So ovular cycles will be mostly regular. So in order to bring ovulation and to restore these functions, this Shatapushpa Rasayanam is highly seen beneficial in all these cases.
What is the method to give this Shatapushpa Rasayan? Somewhere you are
Shatapushpa
giving 5
Rasayan,
grams. Yeah,
yeah,
dose is different. Anupan is
yeah,
different.
dose
Then
is
how you
different,
decide?
ma'am.
Yeah.
So, yeah,
Mm.
yes, we start with the minimal dose. So usually we start with 2.5 grams, and according to the koshta, nature of the koshta and the patient, we will give in some patients, if the koshta is irritated or gastric irritation is there, then we will add just milk we will add. In some patients, we will add pure krida. As described in classical references, 2.5 grams can be added with little amount of krida. And in some cases where they can tolerate this tila taila, this can be given with tila taila also. So the anupana we can select according to the type of the patient, according to the koshta, and according to the tolerance of the patient. And gradually we increase the dose to 2.5, 3.5, 4, 5, 7.5, 10 grams we can give. And after once these we give it for maximum we give for 7 to 10 days. And after once we feel some gastric irritation, we slightly slow down or we slightly reduce the dose. And finally we come to the first dose that up to 2.5 we reduce, so that we can give maximum we can give for 14 or 21 days.
Okay, rightly. It means ki,
Ma'am, what is the
like
reference?
What,
Namaste,
ma'am?
ma'am. Namaste, ma'am. What is the
Namaste.
reference? Ma'am,
It's
which are
mentioned in, it is mentioned in this Kashyapa Samhita in the
Kashyap Samhita,
yeah,
Shatapushpa
yeah,
Kalpadya.
Shadapushpa Kalpa, yes, Shadapushpa Shadavadi Kalpatyaya.
Hmm.
thank
Like
you, ma'am.
Vardhaman Pipali Rasayan you are giving, increasing and then decreasing, no? Like Rasayan we give Vardhaman Pipali
Yes,
like
yes,
types.
yes,
Yeah,
yes,
same as you are increasing and then decreasing.
yes, yes, yes,
And Anupan is according to the patient you are changing.
yes, yes, yes. We can take Krida. It's mentioned in the classical reference. Then Tilataila we can take. And in patients who can't tolerate this Krida or this Taila, we can use milk, simple milk.
Yeah, yes.
And I think
Anybody
it
else
has
want to?
wonderful effects, this Shadapushpa Rasayana. In this PCOS patients, if we can give for some 10 to 15 or 20 days, it is really helpful in inducing cycles.
Yeah, yes. But some people don't give orally, and many places people are giving Nasya and Basti. You have not mentioned
Yes,
Shatapushpa
Shadapushpa Nasya Taila.
Basti, yeah.
Yes, I
Yeah.
think. But oral medication has its own effect. Then this Shadapushpa Nasya Tailam can have effect in correcting this hypothalamo pituitary functions and all. Yeah.
Mm-hmm.
Anyway, we have to First of all, we have to do some udvartana so that we can, this obesity can be corrected. Then some Churna Pinda Svedas can be given. After correcting or after bringing down this weight, only these nasyas will be helpful. Once he is having excessive weight and all, even if we give some rasayana, some this tilataila or anything like that, I think as far as in my practice, nothing will work out. But once this weight is reduced, or the kaba or avarana or the medo, mamsa medo dushti can be overcome with medication or some procedure or with exercise, proper diet and exercise, these medicines and panchakarmas will be effective.
And what do you think in the lean patients?
Yeah, lean
Not
patients,
obese,
ma'am,
not
is
obese.
actually, lean patients, actually, it is difficult to handle these cases of lean PCOD because we can't administer these excess chodhana bios, we can't give. So for that, we give Saptasaram, Gandharvasadi Kashayam for this pacification of the Vada. Then after that, Snehana, this preferably this Dadimadi Krida, Induganda Krida, or Sukumara Krida will be given, and for in the minimal dose or in the in some patients when they tolerate, they can be given in the acha matra, or for them this Vijarana Sneha Prayoga can be administered. After that, Rasayana Prayogas and Vasti can be done. And here also this Jivaniya Ganakrida Nasya also can be given. But in lean PCOS cases, excessive, intense, these Tishna Vayas or Shodhana Prayogas cannot be given. But for them, this medication, Shamana Aushada, along with these Snekabana, then Virejana, Abhyanga, then this Rasayana Prayogas can be given.
Yeah, in those patients we are not using Shatapushpa Rasayana.
Yes, Shatapushpa we can give, ma'am. I mean this Tishna Ubayas like Udvartanam. Then Udvartanam for 2 to 3 days we can give.
Yeah, Udvartanam is
Yes,
not
for
beneficial.
just improving the circulation and all. Even though she is lean, there will be some impaired metabolic functions. So in order to correct or to bring some enhance the enhance circulation, we can use this Udvartana for 2 to 3 days in a minimal, as a minimal procedure we can do. Then CPS also 2-3 days we can do. And for the obese patients, we can do this Udvartana for up to 14 days. And after 14 days, we can see that the weight will be reducing from, if it is 80 was there while at the time of admission, after 14 days, it is gradually getting down to some 5-6 kilos will be reduced.
Yeah, nice. Anybody else want to ask? Or add something? Ramadevi madam, do you want to add anything, madam?
Namaste, madam.
Ramadevi.
Yeah,
madam.
Namaste. Namaste. Good evening, madam.
Good evening. Nannayirunnu presentation.
Okay. Thank you, madam. Thank you very much.
Okay. Questions അങ്ങനെയൊന്നുമില്ല. നല്ലതായിരുന്നു. Presentation is good.
Yeah, thank you,
And,
madam.
Hingu Trigana Taila, you are giving for everywhere like Sneha Pana.
Yes, Singutragana. Yes. Singutragana, it can bring drastic purgation. I usually prefer Gandharva Erandam, Avibhakti, etc. So that Mridu Virejana, all these as mentioned in classical, these Mridupur Panjapur Nari, all these females should be, in females always these Mridu Upajaras are seen beneficial as it is mentioned. And in my practice also, I feel that excess or intense this Virejana Ubayas are little bit difficult to manage or for the patients, in my experience.
Okay. So Mrudu Virechana you are giving?
Yes, ma'am.
Mrudu Virechana, okay. But Hingu Trigana Taila is beneficial for Virechana, na?
Yes. Hingu Trigana is beneficial. It's beneficial, really beneficial, ma'am. In the minimal manner, it can give. And those who have Krura Koshta, in patients with Krura Koshta, we can administer Hingu Trigana.
Okay. Mrudu Koshta people?
Mridu Koshta, usually I give this Gandharva Eranda, or in some people, this Thaila, if they can afford this Thaila, then I'll give this. Some people say they are comfortable with this churnas or Avipati churna. And some people, some patients say they are comfortable with this Gandharva Eranda Thailas. So, as per after analyzing the Koshta and all, it's me who decide. Even still, if they are not at all, or if they feel irritation of the stomach, then I give according to the condition of the patient.
Okay. Usually in PCOD, we'll prefer Vamana because it's Vata Kapha predominance, no? Than
Yes.
Virechana.
In severe conditions, Vamana can be a kind of option, because in order to eliminate this excess Kapha and all, it's good to administer this. But for that, we have to admit these patients, and these patients should be willing for that. Willing actively, they should also come forward.
Definitely.
That's the problem. Nowadays the patients are very sensitive. They are very sensitive. They are afraid of this procedure, oh Vamana.
Yes.
And some of the patients who are staying nearby will teach them like it's very difficult to manage this Vamana. These all things can happen, and finally we'll be tired and all. And this hearing all these things, the patient will be having some fear and anxiety.
What do you think about Kashaya Prayoga? Kashaya.
Pardon, ma?
Kashaya. Instead of Thaila, can we use Kashaya?
Kashaya Prayoga.
Yeah, Kashaya, Gandharvastadi Kashayam, then Saptasara Kashayam, Kanashadahodi Kashayam, Chiruilwadi Kashayam. All Kashayas which can pacify the Vada can be beneficial.
For that purpose, Virechana purpose.
Virechana is highly effective. For that, we can select according to the Koshta and Dosha and Dusha. We can select Gandharva Eranda, Avipatti, Hingutragana. Any Virechana we can select according to the, after analyzing the Dosha, Dusha and the type of the Koshta. Then Ellu Kashayam, they said that Tilakwada, madam. The Tilakwada mentioned in Gulma, it's also very, very effective. Krida Guda Vyosha Bharni Rajonyuda. That is, we add, in some patients, we will just
Bharangi is very good, na?
Yes, Bharni is very good. And in some patients, we just ask them to take along with Sibyl Krida. In some patients, we will ask to take with Sumara Krida. In some other patients, we just ask them to take it with Indu Kanta Krida. And depending upon the condition, we just tell.
Yes. One question is about Pipalyadi Taila Matravasti. Yeah,
Pipalyadi Taila Matravasti, it is very good for correcting this. Asthis are best indicated for regularizing the menstrual cycle correction. So it can be employed in Nashtartava, Anartava. Then in cases of infertility, in secondary amenorrhea, PCOS patients, this Pipalyadi Anivasala Thailam, which is having normalizing the vitiated vada. It's best indicated. For that, Dhanvantaram Thailam.
Yeah, one question is about Jivantyadi Grit.
Jivanya Ganakrida can be taken for especially in Thadukshaya Vantya, or in order to boost to act in this ANS level, this Jivanya Ganakrida, Kalyanaka Krida, etc. can be taken, chosen.
Yes.
In poor ovarian volume and all, this Jivanya Ganakrida can be taken. Thadukshaya Vantya.
Right. Anjana madam. सुन रहे हैं आप मैडम? दिखे तो थे मुझे।
नमस्ते मैडम। जी मैम, नमस्कार सभी लोगों को।
नमस्ते, वेलकम मैडम।
बहुत अच्छा डिस्कशन, रियली मैम बहुत अच्छा डिस्कशन था मैडम का, और बहुत ही अच्छा प्रैक्टिकल मैडम का हम लोगों को मिला आज ज्ञान। मैडम ने बहुत अच्छे से सब केसेस के बारे में बताया, और शायद पुष्पा के बारे में बहुत अच्छा लगा। जी जी मैम, थैंक यू मैम, बहुत अच्छा लगा और बहुत प्रैक्टिकल नॉलेज दी आपने। और जो मैं अपना अनुभव बस यही बताऊंगी, मैंने शतपुष्पा तेल पर बहुत अच्छे से काम कराया और मैं लगातार चल रहा है हमारे यहाँ। हमने उसको थोड़ा सा जो थीसिस वर्क दिया था बच्चे को, तो उस पे शतपुष्पा का ही हम लोग क्या करते हैं, नस से दिलाते हैं, और उत्तर बस्ती भी हम लोग शतपुष्पा की करते हैं और उस
Yes,
तेल
yes.
की। या मैम, और बहुत क्योंकि उसके साथ हम लोग फॉलिकुलर स्टडी वगैरह भी लगातार ऑब्जर्व करते हैं पेशेंट की, तो अच्छा
Yes, yes.
रेस्पॉन्स आता है मैम। फॉलिकुलर्स पे उसका बहुत अच्छा इफेक्ट है और थिकनेस पर भी बहुत अच्छा इफेक्ट है। मतलब
Yes.
फर्टिलिटी के चांसेस जो होते हैं, जहाँ तक मुझे लगता है, अगर केवल हम सपुष्पा की डाटाज देखेंगे तो 60-70% तक हमको डाटाज पॉजिटिव मिलते हैं। एनोवुलेशन की पेशेंट आती है, या किसी किसी का तो एमएसएफ आता है, इसका जो साइज होता है वही ग्रो नहीं कर पाता है, या फॉलिकुलर डेवलपमेंट नहीं हो पाता है। लेकिन सतपुष्पा जो हमारे आचार्य कश्यप जी ने बताया है सतपुष्पा कल्प अध्याय में, उसका रियली बहुत ही अच्छा रोल है। तो आपने जो आज उसको बताया, तो ठीक, उसका ओरल भी बहुत अच्छा रिफ्लेक्ट होगा, पक्का होगा। लेकिन मैं अभी जो अपने आपको बता रही हूँ, जो हम लोग प्रैक्टिकली इसको यूज कर रहे हैं, वो तेल के फॉर्म में ही यूज कर रहे हैं, नस्य और उत्तरवस्ती के रूप में। जी
Yes,
मैम,
ma'am. Yes, yes.
थैंक
हाँ,
यू मैम।
वही मैं भी वही पूछ रही थी ना मैडम कि हम नॉर्थ में तो सब लोग ऑयल का ही यूज करते हैं इसका, चाहे नस्य
जी
में
मैम,
हो, चाहे बस्ती में हो, चाहे उत्तर बस्ती में हो। शतपुष्प तेल पे ज्यादा यूज कर रहे हैं। मैडम
जी
के
मैम,
सारी प्रेजेंटेशंस में शतपुष्प रसायनम ओरल बताया था, लेकिन वहां पर इन्होंने अनुपान चेंज कर दिया है। किसी में तिल तेल से दिया है, किसी में मिल्क से दिया है, डोज इंक्रीजिंग डिक्रीजिंग किया है। वो थोड़ा सा इनका स्पेसिफिक अलग
जी
एक्सपीरियंस है जो
जी
देखने को मिला कि ओरल दे रहे हैं। जनरली यहाँ पर नॉर्थ में हम लोग नस्य में या उसमें यूज करते हैं ना,
जी
मत्रवस्ती
मैम,
उत्तर
जी जी
ऐसे,
मैम।
हाँ ऐसे यूज करते हैं। तो मतलब इनमें अनुपान इन्होंने तेल का ले लिया, तो चलो
हाँ
अच्छा है,
हाँ,
डिफरेंट है
जी
ना।
जी जी
मतलब
जी।
हाँ। हम्म।
और एक आइडिया मिला मैम, कल्प की तरह यूज किया है, जैसे कहा जाए वर्धमान
हाँ हाँ
है ना,
हाँ
उस तरह से करके अगर अग्नि और बल पे हम काम करें, तो शायद हम लोग को और अच्छे रिजल्ट मिले। जी
हाँ 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 हाँ, ऐसे यूज कर सकते हैं, है ना।
जी जी मैम।
डॉक्टर पवन, आप कुछ पूछना चाहेंगे? पवन डॉक्टर
नहीं नहीं,
लिख तो रहे हैं
बहुत
मुझे।
अच्छा प्रेजेंटेशन है, इंटरेक्शन तो
सर
हमेशा ही हम
आप
लोगों की
आपको
रहना
नहीं, दूसरे एक डॉक्टर पवन है जुड़े
Thanक
हुए,
you, sir.
उनको पूछिए।
है।
दूसरे डॉक्टर पवन जुड़ते हैं हमारे साथ, उनको बोल रही हूँ कि वो भी पूछते हैं ना।
डॉक्टर पवन, आर वी ऑडिबल टू यू?
Yes, sir.
यस सर। मैम
हम्म।
गुड इवनिंग मैम। आज कोई क्वेश्चन नहीं है मेरा, सारा कुछ सही।
अच्छा अच्छा अच्छा, मैंने कहा आपके क्वेश्चंस रहते हैं ना, तो मैंने कहा आपको बोलूं कि आपने कुछ पूछना है क्या इसमें। हम्म।
Any value addition from any member, any participant? If anybody would like to add, like value addition, please. We have 10-15 minutes more in this webinar, so we can discuss that. We can interact easily.
सुधा, डॉक्टर सुधा, डू यू वांट टू आस्क एनीथिंग?
हाँ, गुड इवनिंग मैम।
हाँ, गुड इवनिंग।
नमस्ते मैम। एक्चुअली इट
नमस्ते।
वाज ए वेरी नाइस प्रेजेंटेशन मैम, टोटली प्रैक्टिकल था। तो यहाँ जो मैं एक एक्सपीरियंस शेयर करना चाहूंगी, सतपुष्पा चूर्ण एंड सतपुष्पा ऑयल दोनों प्रैक्टिकली मैं ज्यादातर यूज करती हूँ इन केस ऑफ एनोव्युलर साइकिल्स एंड ओव्युलेशंस। एंड आई also have seen the effect of satpushpa tel uttarvasti in case of endometrial thinning, infertility due to एंडोमेट्रियल थिनिंग। तो उस केस में अच्छा काम करता है सतपुष्पा तेल का उत्तरवस्ती। एंड इन केस ऑफ एमिनोरिया, जहाँ पर हाइपर प्रोलैक्टिनेमिया रीजन रहता है, उस केस पे सतपुष्पा तेल का नशा बहुत अच्छा काम दिया है। 3-4 पेशेंट को मैंने देखा है मैम। बाकी जो मैम ने बोला वो ऐसे ही यहाँ भी हम लोग करते हैं, तो अच्छा रिजल्ट सतपुष्पा तेल का मिलता है। और सतपुष्पा के साथ शतावरी अगर ऐड करते हैं फॉलिकुलर फेज पे तो वो फॉलिकुलर प्रोलिफरेशंस के लिए भी अच्छा काम करता है, फॉलिकुलर ग्रोथ के लिए एंड ओव्यूलेशंस के लिए मैम।
हाँ, इसमें थोड़ा सा मैं बोलूंगी कि जो शतपुष्पा शतावरी कॉम्बिनेशन यूज करना है ना, तो उसमें क्या करना चाहिए कि आपको फर्स्ट हाफ प्री ओव्यूलेटरी फेज में शतपुष्पा कल्प, पोस्ट ओव्यूलेटरी फेज में शतावरी कल्प, ऐसे यूज करते हैं तो ज्यादा बेनिफिशियल रहता है मेरे हिसाब से। जो भी हमने देखा है कि आप पहले शतपुष्पा कल्प यूज कर लो, ओव्यूलेशन हो गया, उसके बाद शतावरी कल्प, तो सेक्रेटरी फेज को वो एनहांस करता है, मतलब आप और सपोर्टिव रहता है कि इम्प्लांटेशन में और इसमें। तो ऐसे करके हम कॉम्बिनेशन में यूज कर सकते हैं, शतावरी कल्प शतपुष्पा कल्प ऐसे करके, है ना।
हाँ मैम, शतावरी तो प्रोजेस्टेरोन का वो इफेक्ट रहता है, वो थोड़ा सा वो
हाँ
एंडोमेट्रियल
हाँ
प्रोलिफरेशन के लिए हेल्पफुल होता
हाँ
है।
हाँ हाँ। तो फर्स्ट हाफ में ऐसे, सेकंड हाफ में ऐसे करके यूज कर
जी
सकते
मैम, जी मैम।
हैं। शतपुष्पा कल्प शतावरी कल्प ऐसे। हम्म।
थैंक यू सो मच मैम।
हम्म। बाकी तो वैल्यू एडिशन करने
अमिनी
वाले अभी
जी,
सब बिजी हैं।
अमिनी जी ऑल इंडिया इंस्टीट्यूट में क्या करते हैं, ये वो
हम्म।
भी एक वर्ल्ड। अरे गजब, लक्ष्मी है डॉक्टर लक्ष्मी, वही लक्ष्मी है क्या हमारी?
नहीं, वो एलपी दे नहीं है ये, और लक्ष्मी होंगी कोई।
हरिओम, डॉक्टर लक्ष्मी है ज्वाइंट, वुड यू लाइक टू आस्क एनीथिंग डॉक्टर लक्ष्मी? बिकॉज द स्पेलिंग इज सेम विथ अवर जामनगर लक्ष्मी।
एलपी दे मैडम नहीं है वो एलपी दे ही लिखती हैं। हम्म
अच्छा अच्छा।
हम्म।
अदर डॉक्टर लक्ष्मी, would you like to ask anything? So many new people also there. Ansuriam, Kirti, Nitika, PP, Suja. If anybody, any question, any value addition, any suggestion. Dr. Nishan Shukla ji. Yes, yes, but Dr. Komal has asked one question.
Yeah.
In this series, we are
Yes, we are.
discussing on infertility, but we have all webinars there. Autism, we have conducted 1 month before only. So if you are interested, you can join those also. But this
नहीं नहीं,
webinar is on
क्वेश्चन है कि
infertility.
इनका क्वेश्चन है
Amini
कि
ji.
हेल्दी प्रेगनेंसी प्लान करने के लिए हमें प्रिकॉशन क्या लेना चाहिए अगर ऐसे बच्चे होते हैं तो, वो उनका
Yeah, the
क्वेश्चन है।
pre-conceptional
बहुत
care
अच्छा
can
question.
be advised, ma'am. Pre-conceptional care. That is
शोधन,
yes,
हाँ,
Snehana Chodhana, then
पार्टनर्स,
Pumsavana Prayogas. Okay, okay.
हाँ, बीज शुद्धि, बीज
Yes,
संस्कार,
Bija Shuddhi, ma'am. Yes. Bija Samskaras can be employed, ma'am.
हाँ,
Because
बीज
nowadays these
संस्कार भी।
autism cases are rising high up. And in our cases and in our hospital also for in Kaumarapatyava, so many children are suffering from autism actually. And I think during before planning pregnancy, from that time onwards, these females are supposed to do all these Shuddhi procedures or this Bija Samskara Ubayas. And during pregnancy also, they have to obey certain rules and regulations. That is, as per the antenatal care advices, they have to do. And in the nowadays, these women are working and they have dual role, and they are burdened with stress and workplace. This home workplace management is very difficult, and I think all these are the contributing factors for the higher incidence of autism in the present clinical practice. So they have to plan the pregnancy. First of all, I think that they have to plan. So before planning that, this Bija Samskaras, all these things can be helpful. And during pregnancy also, they have to take As a must, they have to take some protein-rich food. Then in our classical textbooks, it's the milk, then krida and kshira. These are the best food items for that. So these things contain the essential proteins, vitamins, minerals, and everything that is essential for the growth of the fetus and for the health of the mother. So all these things should be taken. Then all the medications, all these rest should be there, proper sleep should be there, mentally you should be in a cool state during that pain, during that period. And all these in 9th month charya can be observed. And all these can ultimately result in the birth of a healthy project. And in in Charaka Samhita, it's mentioned that healthy abatya, for the abatya janana, Sreshta abatya janana, all these things are highly beneficial. Sreshta abatyam, that means abatyam with all excellence.
Yes, right, madam. That is very much important. Nitya KshiraGhritabhyasa. Nowadays, what is happening that people are staying away from this Ghrita and the Kshira.
Yes, Krida and all.
Yeah,
This actually, this Kridas can work well during pregnancy. This
Don't
can
take dairy
impair, this can
products.
balance the impaired immunity. It is best for the growth of the proper growth and development during the initial phases of embryogenesis, so that the fetus can have normal growth and development during the intra gestational period.
Madam, one question is from my side that
Yeah.
during your lecture you mentioned the proper Rajaswala Paricharya. What
Yes,
different
ma'am.
thing you do over there in Rajaswala Paricharya? Here in North, generally focus is upon the use of barley, right? And over there, what you advise
Yeah,
different?
what we advise them is that just to stay away from this hard work or healthy, for strenuous exercises. And some dancers are there, some are involved in sports activities. So we just advise them to keep away from hard physical activity, so that
Oh,
this
Bihar.
uh, yeah, this can be advised. And along with that, I always advise them to this before this starting this periods, I advise them to take plenty of water enriched with this some jeera or some the something which can this enhance the acne factor, or it can the proper functioning of it can promote the function of the acne. Then I'll ask them to take enough water, hydrate so that the body can be hydrated. And then hygiene should be maintained. Nowadays, these what these girls do is that they will just put one pad and they will be retaining for a prolonged period. That also can cause some infections. So maintenance of hygiene should be given prime importance. They stay away from these unhealthy practices. Then body should be hydrated. Then the pads should be changed at proper intervals. Then sometimes they may be using this menstrual cup and all, and that should be properly sterilized before inserting. Then the proper rest should be taken. Then nutritious food also should be taken during this time. And nowadays, these girls, what they are doing, they'll be taking some junk food, this pizza, burger, and especially before and after this periods and all, they are supposed to take light food, so that some patients say that when the food habits have been changed to fibrous food, and when they have proper exercises and when they consume light food, the pain gradually diminishes. Especially in endometriosis, we have seen like that. So this Rajaswala Charya is very, very important in the present scenario.
Rajaswala means during bleeding phase, we have to advise something different, right?
Yes.
So,
During bleeding phase, yeah.
yeah, including Ahar and Vihar, both the things we have
Yes,
to advise.
both in Ahara and Vihara, ma'am. I think both in Ahara, we have to do some modifications. And we have to give them proper awareness about the food and Viharas they consume.
Yeah, you are focusing upon Vihara during breeding phase, I think so.
Yes.
Yeah. Here in North, generally, it is advisable that use of barley, Havishya Bhojanam, that is
Yes,
mentioned in
yes, yes.
uh,
This dried
that-
fried items, especially this lace, then this juices and all this um, artificial juices are there. These all things can impair the normal gut functions.
yeah, not to take is right. That we advise that don't take junk food, yeah, processed food,
Yeah.
everything that
But that's
it is
not
being
practical
prohibited.
nowadays. Yeah.
Yeah.
We can advise them to curtail or to minimize the use.
Yeah, but what to take, that is also important. They will ask then what we have to take uh, different during this phase. That is also one question from the patients that this I will not take, but anything else specifically you are going to advise me that what I have to take during that phase. That is very much important. So here we generally advise them to take barley and
Yes,
like
ma'am.
that. Yeah,
Okay.
yeah, yeah, that also can be advised to them that do the I think that you are telling that proper cleaning of the bowel, it is also
Very
yeah,
important.
support, yeah, during that phase also, that correction of apan vayu, that
Yes, yes, ma'am.
uh,
Yes. Then
nishkramana, that
Kaushna, the maintenance of this bowel functions is also very important. Fibrous food,
yes,
light food, fibrous food, easily digestible food, all these can correct the functions of Abana Vayu.
apan
So
vayu,
once
yes.
it's, yeah, so that it can, we can control the ectopic deposition of this endometrium.
Yes, upon why will be corrected, then Artava will be
Vata
not Pratilom Gati, Anulom Gati, and
Yes,
we can
yes,
save
yes.
them endometriosis.
Yes, yes.
It is very
Because
common nowadays.
endometrious
And
cases are rising high up in the society.
yeah, right.
Very much,
Yeah.
yeah, its prevalence is too high nowadays.
And one thing is very much important, that early to rise is very much important. Gut
Yes, yes, yes.
motility, gut movement should be started early in the morning. Otherwise,
Yes,
there
yes.
can be pratiloman of Panvat. That is also
Yeah,
important
ma'am.
thing.
Nowadays,
That,
especially those who are working in the software field and all, they'll be working late at night and they will be
yes,
sleeping till 10 a.m. and 12 a.m. So that this
that
gut function, this,
also.
yes, the BM, this basic metabolic functions, everything will be impaired.
Yeah. And so a pratiloma upon vayu, that is due to that improper gut movement, late
Yeah.
movement start. Yeah, that is important.
They should get
Yeah.
up at least by 7 a.m. early in the morning, not in the early in the morning, by at least 7 or 7:30 they have to get up. But nowadays they sleep till 10, 12, etc. And after getting up from the bed, they will be consuming some pizza, burger, etc. And along with that, some other juices and all this artificial cola, Pepsi, like that. Now these
Mm.
girls and even those females in the reproductive age also prefer those type of food. A normal food they don't want.
Mm. Not want to cook the food. That is
Yes,
nowadays
yes.
trend. Trend. Yeah. Yeah. So
So
uh,
creating awareness from our part is, I feel that is more important. So creating
yeah,
awareness in women, creating
yeah,
awareness in the new gen females that these things are considered as do's and these all are considered as the don't factors, and you have to stay away from that for the proper reproductive health and for the health of the next generation. You should be healthy. Like that, we have to advise.
yeah,
And
yes,
whenever
yes,
we
yes.
go for camp and all in these schools, we advise them like that.
Yes, that is our duty. I
Yeah.
think so.
Then proper
Yeah,
screening,
yeah,
ma'am. Normally,
yeah.
when they reach a particular age and when they when they couldn't conceive, usually when they approach a doctor only, they come to know that they are suffering from endometriosis. So those patients suffering from severe menstrual pain should be screened from in the school level itself. There should be given the awareness and proper screening also should be given.
Yeah, yes,
Then we
yes,
can
yes, yes.
curtail the growth and further or the worsening of the situation can be prevented.
Preventive aspect of the
Yes,
infertility,
yes,
that is
it's very
important.
important.
Yes, yes.
Preventive as per Ayurvedic physicians, we have more, we have to
Yeah.
focus more on these preventives also.
Yes, yes, yes. So I think Pavan sir, over to you now. Mm, Thanks to madam. Very nice
And thank you,
presentation
madam,
and
very much for inviting
very
me and
nice.
giving me an opportunity to have a discussion with you. So for me, it's a great opportunity. It's a wonderful opportunity to have,
Nice to see
I
you.
mean, yeah,
Mm,
yeah, ma'am.
Nice to
Thank
see
you
you.
very much.
Yeah,
Thank
Pavan
you to
sir,
you,
over to
madam.
you.
You are first time on
Mm.
the platform, so I would
Yes,
like
ma'am,
to
sir.
communicate my regards to you. And this
Yes, thank
platform
you, sir.
belongs to you.
Yes,
Please
yes,
do join because we
yes, sir.
are conducting webinar on different topics. Every
Yes,
topic,
sir.
not different topic, every topic.
Topic.
So please
Okay.
do join. And I have
Okay, okay.
circulated my paid program, schedule. Please guide me, all of you, please guide me in which webinar you would like to uh, participate actively as a speaker. I will be inviting you. It is my standing invitation to all. Thank you very much. एंड अब ऑल कामिनी जी बहुत बहुत आभार आपका. जय हो. कहाँ दुबई, कहाँ मैं यहाँ भोपाल, कहाँ मैडम तिरुवनंतपुरम. आप इतना शानदार कोऑर्डिनेट कर रही हैं. आई एम रियली ग्रेटफुल टू यू. Excellent, excellent. Our next webinar is on because we have lost our Vijaya from Ayurveda unwantedly due to NDPS Act. Our doctors are fearing to write Vijaya medicine. Anxiety, pain, means so many researches have been conducted on Vijaya, but unfortunately, our doctors are now fearing, afraid from this NDPS Act, and when cannabis leaves are not mentioned directly there. So that controversial rule and law will be, should be revoked in our opinion, and Vijaya must be regulated for our Ayurvedic medicine. Opium they are using in palliative care. Vijaya everywhere is being used as hemp and cannabis, but we have lost our Vijaya. We have lost our hyphen. Opium, Vijaya, but those are also medicine. When government has declared Schedule 1 that we have to write instruction and warning on the label, we are ready to do it. But now no manufacturer is interested to manufacture and no doctor is interested to write. Even this is the best medicine. Thank you. Thank you very much. For next panel, I would like to welcome Mr. Sachin Avasthi, Dr. Shivram, Mahesh TS for Vijaya webinar. Within 1 minute, I am changing the link. Please stay with us because in Vijaya, what are the hurdles and what are the solutions? We would like to listen from our speakers. And just for kind information of all the participants in this age of 62 years, I am pursuing my PhD from Parul University on cannabis to re-establish with a mission to re-establish, not for recreation, but for clinical. Thank you. Thank you very much for all. Please stay with us. Within 1 minute, I am changing the link.